Now, pay close attention to this area, right at the border of the vaginal opening. This, my friends, is where the hymen is located. As we zoom into the vestibular area, you can see the hymenal rim more clearly. It's a thin, elastic mucosal structure that partially surrounds the vaginal opening. Notice these small openings nearby. These are the ducts of the Bartholin's glands, which secrete fluids that help lubricate the vaginal vestibule. Hi, I'm Dr. Laura, a urological surgeon, sexologist, and women's health expert. My goal is to make women's health simple, practical, and backed by real science. If that sounds like something you're into, don't forget to like and subscribe. It supports the channel and keeps you in the loop with real, no-hype facts. Now, let's take a closer look at the different types of hymens that naturally occur. Here are a few examples. Cribriform, with multiple small openings. Imperforate, with no opening at all. Microperforate, with only a very tiny opening. So, what is the hymen actually made of? If we examine it under a microscope, we find that it consists of non-keratinized stratified squamous epithelium. Beneath that lies the lamina propria, which contains tiny blood vessels, elastic fibers, and a connective tissue matrix. Let's rewind a bit and explore how the hymen develops in the first place. During fetal development, between 6 to 20 weeks of gestation, the Müllerian ducts begin to fuse and the urogenital sinus differentiates. The hymen forms as a remnant of the vaginal plate during a process called canalization. It's incredible to think that this small structure has been part of us even before birth. One of the most misunderstood features of the hymen is its elasticity. Watch closely as we simulate mechanical pressure on the hymenal tissue. See how it stretches. This elasticity allows the hymen to accommodate pressure without necessarily tearing or being damaged. The hymen also changes over time, throughout a person's life. In newborns, it's usually thicker due to maternal hormones. During childhood, it becomes thinner and more translucent. At puberty, estrogen increases its elasticity and vascularity. In adulthood, it remains elastic. In postmenopausal stages, it becomes thinner, paler, and less elastic due to hormonal changes. Clinicians often assess the hymen and surrounding genital structures, including the Skene's glands, located near the urethra, as part of comprehensive pelvic exams. These glands also help with lubrication during sexual arousal. In summary, the hymen is a normal anatomical structure with natural variations. Its characteristics are shaped during embryological development and change with age and hormonal shifts. It is elastic, versatile, and often misunderstood. This exploration reminds us of the complexity and diversity of human anatomy. Stay curious and keep learning.